to the Emory Simulation Center. I'm going to take you on a bit of a tour. Come on in. We're here at Wesley Woods, and this is the part that the nursing school uses for preparing nurse practitioners and midwives for practice. We're going to walk down to the outpatient clinic, so come on. We had over 100 students here this semester learning how to do physical exams and other procedures that are commonly done in an outpatient setting. Students have 5 hours of lab here during their first semester, a 2-hour procedures lab and a 3-hour outpatient clinic lab. And this is where they wait. We're kind of sparsely furnished, but students are often, if this were another day of the week, it would be filled with students sitting and waiting to come into clinic, studying or working in groups around different projects. This is the skills lab, and this is where students do their outpatient health assessment class. We also have a lot of simulations that are offered for procedures that are frequently done in the outpatient setting. Things like patient interviews, examinations of patients for commonly seen problems like pneumonia, or we do a lot of simulations for women's health and men's health. So come on in. Here are some students.
Hello.
Hey. And they're waiting for their practical exams. So they have their final exams today. They have to perform a full physical in front of their faculty member and get graded on it. We're doing physical exams in here today, so it's a pretty basic room. There's an exam table, a chair for the provider. We have otoscope, ophthalmoscope heads in here. And what we commonly do in here, so over the course of the semester, students have, as I said, 3 hours of health assessment lab where they learn to do physical exams on each other, but we also have a lot of simulations. So this is our medical records section, and this is where it simulates in an outpatient clinic where people would be charting on their patients and taking interviews. We have 12 exam rooms in this section, possibly 15 depending on how we manipulate the space. We also have some breakout rooms. So you can see it's kind of a hodgepodge of equipment. Some of the rooms have tables, some don't. Some have desks, and these rooms are used for group activities. So after a student does a procedure or sees a patient, they'll come in here and discuss what their differential diagnoses are. A lot of our focus in this clinic is outpatient. So if you were to be running a clinic in your corporate office where patients could come for something like low back pain, a cold, even something like suturing, they would be trained to do that in this space. Students can come in and see the patient. They'll be able to know how to look at chest x-rays. They will know how to evaluate heart sounds, lung sounds, be able to diagnose and treat from what they learn here in this particular class.
So this is the room that we teach the skills in. This is our procedure lab. And we start teaching these skills in the fall semester of the first semester that students are here, and they continue to return to this lab throughout their 4-semester or 5-semester academic program, where the skills that they will need, which are their core competencies for their specific training program, will be reinforced. For example, we teach over 30 procedural skills to nurse practitioners. We teach x-ray interpretation, we teach extremity, injury treatment, splinting, evaluation of fractures, fracture care. We have simulation stethoscopes where we can teach students how to auscultate abnormal heart and lung sounds so they can be better informed as to identification for treatment purposes. We teach foreign body removal from the nose, from the ear. We teach dental procedures for students that are going to be involved in primary care, where oftentimes they'll have to be taking care of the dental needs of patients. We teach ear assessment and treatment, foreign body removal. We teach treatment of eye injuries. We have a slit lamp, which we use to teach emergency nurse practitioners the standard of care for evaluating eye complaints. We teach procedures related to joint abnormalities and joint trauma, joint problems, how to aspirate joints, and instill medications for treatment, nail trauma, skin biopsy, suturing of wounds, stapling wounds, burn care, digital anesthesia, and in this room we have equipment that we use to teach advanced procedural skills to our acute care and emergency students. We have an ultrasound where we teach ultrasound guided vascular access techniques. We teach intubation for patients who are requiring airway maintenance. We have this lovely lab with plenty of space where students come generally once a week throughout fall semester and then at various times throughout their subsequent semesters, so they have time to practice so they can actually develop competency in those skills.